Hey folks, today I'm here talking with y'all about managing pain in seniors. A lot of the things we're going to discuss today, the information isn't specific to only seniors, just often does affect seniors. And we decided to put this out on YouTube because I do this presentation all throughout the community. We've had a lot of requests for people that have missed it and have asked if we had a handout. And I just thought, what's better than a handout versus the live thing of Mr. Sparkle. So with no further ado, today we're going to be discussing managing pain in seniors. If you have any questions or concerns, put your hand up. Just kidding. You can leave it as a comment and we will get to these questions. By all means, I hope everyone remembers that this is just general basic information for the general public. If you have specific concerns, make sure you talk to your pharmacist or your doctor or your healthcare team about it. Drop a question below the video and I can try to address it. But for the most part, we try to keep it very high level so that it applies to the masses. Okay? Why does pain matter? Chronic pain affects many older adults and can significantly impact quality of life. So we're going to explore the different types of pain, the different types of pain management, and see what makes sense for you. At the end of the presentation, I'm going to pop up some statistics. There are a lot of statistics. We won't get into that just yet, but you'd be shocked with how many older adults are living with pain, how many older adults are letting or have pain that is affecting their quality of life. Okay, so we need to treat the pain. Let's figure out how to do that together, and then we can go from there. Okay, so there are two types of pain generally. There's acute and chronic. Acute is something more short-term, often related to an injury or some sort of surgery. So you fell, you hurt yourself, you've just had surgery. This is a short-term issue that we assume will be resolved within X amount of time. So we just got to get through this short period versus chronic pain, long-lasting. This usually means it lasts longer than 3 months and often associated with some sort of diagnosis or medical conditions such as arthritis, nerve damage, injuries that never fully recover, things like that, or sometimes certain chronic health conditions do come with pain associated with it. What are the over-the-counter agents you can use for pain? So most people know the basics that are available. You've got your Tylenol, you've got your NSAIDs, aka Advil, ibuprofen, Motrin, Aleve, naproxen. So Tylenol and NSAIDs. Tylenol is the go-to suggestion, especially in seniors for the most part. Why? Tylenol has a very safe profile for seniors. So you might have heard at times that, oh, but doesn't Tylenol aggravate the liver? Yes, Tylenol can aggravate the liver. However, if you don't have liver conditions, if you don't have liver problems, if you're not on medications that are putting a lot of pressure on your liver, then you should be fine. So with that said, one of the most important things to remember with Tylenol or acetaminophen is that there is a 4,000 milligram daily max. Very important, because if you surpass the 4,000 milligrams, that is where liver issues come up, okay? And I'll explain a little bit why later, why you have to pay attention to the math of acetaminophen, because it can get confusing. So I'm just gonna shove these over to the side for now, and we're gonna focus on Tylenol. What do you need to know about Tylenol? What you need to know about Tylenol is there's too many Tylenol options, and it can get overwhelming when you're in the aisle. And what I mean by that is there's Tylenol regular strength, there's Tylenol extra strength, there's Tylenol arthritis, there's Tylenol migraine, there's Tylenol ultra. There's Tylenol 1, 2, 3 with codeine, there's Tylenol, there's so many different types of Tylenol products, so you need to be careful. So for the most part, what you need to wrap your head around is when choosing Tylenol for yourself, if it's for immediate need, I'm in pain now, then you're gonna wanna take something like Tylenol regular strength or Tylenol extra strength. That releases all of that Tylenol immediately, okay? Whereas Tylenol arthritis, 650 milligrams gives you half of it now and half of it later. What that means is it's giving you some immediate benefit, but also delayed benefit, delayed onset. So for people that have arthritis, generally safe to assume that you have pain that's always there or pain that continues. So having a medication that gives you a little bit now and a little bit later makes more sense in terms of full daily coverage, okay? So when taking Tylenol extra strength, often the doctor will tell you to take 1 or 2 tablets. Those are 500 milligrams, so 1 or 2 tablets, up to 3-4 times a day. Don't start by maxing the dose out. You always want to start with the least effective dose. With that being said, if your pain is always by midday, then go ahead and taking Tylenol in the morning can sometimes help prevent getting some of that midday pain. Or if you wake up in the middle of the night with issues, then taking it before bed. So the main point here is, as we start to figure out if you have acute pain versus chronic pain, if you've got chronic pain, if you've got arthritis, then we know that pain is coming. It might be better to stay ahead of the pain versus treat it. So I want you to always consider, what is your pain on a scale of 1 to 10, okay? If your pain is 10 out of 10, Tylenol is not gonna work well for you, okay? So the goal is to prevent your pain from becoming 10 out of 10, and you can only really do that if you're ahead of the pain, okay? So in acute situations, we normally just take regular extra strength Tylenol, okay? Stay under the 4,000 milligram mark. Tylenol can be taken with or without food. It does not generally upset the stomach, but if you have a sensitive stomach, then eat something first, okay? And if you are using Tylenol products, with respect to the daily max, what you're gonna wanna make sure is, are you also taking Tylenol 3 with codeine from the doctor? Are you sick and maybe taking Tylenol sinus? Are you unwell and having neocitrin, which has acetaminophen? So please be careful if you're using Tylenol related products, that if you're getting acetaminophen from multiple sources, you need to make sure it's all less than 4,000 milligrams or 4 grams, okay? With that said, the next step after Tylenol usually is this group here. This group is known as NSAIDs, non-steroidal anti-inflammatories. It's not a steroid, okay? So it's a non-steroidal anti-inflammatory. They help with pain like Tylenol, but these medications also help with inflammation, swelling. So often acute injuries or certain types of injuries, arthritis included, there is inflammation associated with the condition or with the pain. So if there's lots of swelling, you're gonna wanna use these medications. Keep in mind, Advil and Motrin use the same medication, same common ingredient, AKA ibuprofen. So house brand is just ibuprofen, which is the plain molecule. So make sure not to double dip. These medications, often we try to reserve them for short-term instances, or we might have to avoid them with certain seniors, especially if you are on other blood thinners, because these medications have blood thinning properties, or these medications can aggravate the kidney. So if you have kidney issues, you're gonna want to avoid these. And often these medications, if taken long-term, can affect blood pressure. So all these circumstances, we wouldn't want to use this class of medication. That's why we often use Tylenol. As I said before, it has a safer profile, okay? These do have a place in therapy, which is if Tylenol or the basic things you're doing are not working, then we can use these items. However, you're gonna wanna make sure with your doctor or your healthcare team, are your kidneys good? Is your stomach strong? Is your blood pressure stable? Very simple solution to an upset stomach is eat something first. When you eat before taking this medication, your stomach has a coating around it, which helps to prevent upset stomach. Okay, so eat first and then you can take these. Okay, so for the most part, that's what you got to know about those medications. If you're unsure, check with your doctor, please, to make sure there are no unwanted interactions. Review your medication list. With that said, there are a few more over-the-counter options. So a lot of people will ask about a rub. So you've got your anti-inflammatory, Voltaren. Voltaren is like a topical form of Advil, ibuprofen. It's an NSAID. So we just discussed NSAIDs. Voltaren is an NSAID. So it's a great option for pain relief and inflammation, topical inflammation, okay? But what about blood thinning and drug interactions and kidney? Check with your team, as I've always mentioned. But with that said, often a topical in small localized area is okay because it's not going throughout the whole body, right? It's just locally absorbed, local action that should reduce the risk of increasing your blood pressure, blood thinning, drug interactions, kidney problems, etc. If you're not sure, double check. Because what some people forget is applying Voltaren to my knee or my elbow, probably fine. If I've got a sore back and I'm applying Voltaren to my whole back, well, now that's a very large surface area, which means a lot more absorption, which means it could now become more of a drug interaction or a contraindication for you, okay? So review that with your doctor if you're unsure. With that said, there's Voltaren, it can be helpful. Then you've got things like A535, heat rubs, heat patches, cold rubs, hot packs. These things can be helpful, but they're more that they create the sensation of help. And what I mean by that is not including the Voltaren I was talking about before, but the hot and the cold. You know, cold can feel nice and work as a bit of an anti-inflammatory. That's really, an ice pack is really only going to be helpful in the very early stages of an acute injury, okay? Whereas if you've got chronic pain, the cold feels nice, but it's not really resolving anything. The heat from these patches and rubs, it feels nice. It'll give you some relief, but it's not going to resolve the problem. So just keep in mind that they do feel nice, but if the pain keeps coming back, it's because they're not really going to resolve the problem as much as buy you time in the recovery process. Okay? Some other things we can discuss. Non-drug alternatives include physiotherapy. Okay, so if you've got a knee injury or you've just had your hip replaced, chronic back problem, go see a physical therapist. Some people like chiropractors, osteopaths. These are health professionals that will give you help from a non-drug perspective in terms of stretching, strength training. These things help. You know, I tore my meniscus a couple years ago, and just I have a personal trainer that I told him, hey, my knee is bugging me. This is what happened. And we put hyper focus on rehabilitating the knee and the legs. And, you know, exercise does make a huge difference. So sometimes seeing a physical therapist helps to get you on the right path so that you can do the right exercises and stretches to improve and or prevent further injury. We've discussed hot and cold packs. There are mind and body techniques. Really, that just means meditation, mindfulness. I know that there are some types of pain or some types of moments where just slowing things down, maybe going for a walk, resting, lying down, stretching can help with your pain. Now, mind you, those techniques are probably not likely to help you if you've got 10 out of 10 pain. but I know after I get the kids to bed and my back is a bit tight, 10 minutes of stretching in front of the TV can do wonders and often can avoid me thinking about needing a Tylenol or an Advil. Obviously, this situation a little bit different than a 70-year-old who is in pain and has chronic pain, but this is just something I want you to wrap your mind around. The last non-drug option, which obviously can have big impacts on our life, but again, it's only gonna do so much, is diet and nutrition. So, you are what you eat is a thing. And if you've got pain and discomfort and you're eating fatty foods, greasy foods, if these foods give you stomach upset, if they make you bloated, it can aggravate your system. It can influence inflammation. The hot topic these days is inflammation, swelling, and our bodies have a lot of inflammation. So eating processed foods, eating poorly, eating late at night, I know this sounds funny, but if you've got chronic back pain and then you're super constipated and bloated, that can aggravate your back pain, okay? So sometimes part of pain management is keeping the whole system in check, making sure you're sleeping, making sure you can exercise if that's a thing, making sure you have a well-balanced diet can play an important role in long-term pain management. There also are some foods that have anti-inflammatory properties. Cinnamon, turmeric, can you include that in your tea? Can you sprinkle that on something you're eating? You might be able to. Now, I don't cook, so I don't have the best recipes for you. I'll ask Mrs. Sparkle to make something for you. However, investigate the foods that you like and find out, is there something you can do? Fish has a lot of omega-3 in it. That is proven to have anti-inflammatory benefits. Same with many nuts and seeds. So including these things have that benefit. So the last thing you can consider at home when it comes to pain and physical therapy is what tools can you use, non-drug related, that can help with pain. So option one is, you might have seen this from some physiotherapists, is a Theragun, or basically like a massage gun. So these can be helpful for certain people. Please be careful if you're a senior, because these guns do pack a powerful punch, no pun intended, but essentially it's providing a massage type of relief, okay? So sometimes by using this, you can see this is gyrating here. So let's say I had a sore shoulder and you want to do something like this. Can be helpful. It's only helpful for certain areas, okay? So you need to be mindful of that. You also always want to start low and go slow. So don't do this for too long. Do it for a short period of time. See if there's a benefit. I know for myself, I get a certain knot in my back. This can be helpful, but I need somebody to use the gun on me. Can be helpful, but it has certain limitations. That's one form of physical therapy you can do on your own. Another one, which you might have seen at the doctor's office, we do sell these at Sparkle. I have found these quite helpful myself, is if you've ever seen one of these, it's called a TENS machine. Basically what these do is they provide electrical stimulation to muscles or nerves, either to stimulate the muscle to contract and start exercising and working out again, or what this does is sometimes it can help to dull nerve transmissions, which reduce nerve-related pain. Again, maybe try this with your physiotherapist for the first time. I find it is helpful for me to buy it because most of the time when I'm gonna wanna use these types of stimulating pads, it's at night when I'm watching TV. These pads can be used on your shoulder, on your knee, on your back, and then you just dial up what level of pressure is appropriate for you. So again, can be helpful in certain circumstances, but it has its limitations. First time, I would recommend going to a physiotherapist before purchasing something like this and seeing if it's helpful. They're quite user-friendly and easy to use. And then the last thing you can consider, is using some sort of brace. So brace will help to provide compression on something that's hurting chronically. Okay, so this one is just easy to show you. If you've got tennis elbow, you know, instead of taking medication every day for tennis elbow, golfer's elbow, wearing a brace like this, for instance, helps you to actually repair the injury, and it can help to reduce the need for medication. So again, if you have a bum knee, it may be helpful to wear a knee brace, which can help prevent needing medication. Or maybe said knee brace helps to keep your pain at a level 3, and that way only basic Tylenol is needed versus needing something a bit stronger. So by now we've kind of talked about all the basics. Over the counter, things you can do yourself, things you can do with a physiotherapist. Now I'm gonna try to talk a little bit more about what to do when it's time to escalate your pain needs. Essentially, what if all of the above is not quite cutting it? Well, then we move to prescription pain management options. The first easiest one to discuss is NSAIDs. We discussed the over-the-counter NSAIDs, Advil, ibuprofen, naproxen, Aleve. Well, there are prescription strength NSAIDs. Stronger dose of naproxen, meloxicam, diclofenac, Arthrotec, maybe you've heard of these names or not. Either way, these stronger forms of anti-inflammatories can be very helpful. They work, as I said before, with anti-inflammatory properties. However, with that said, they've got the same side effects as the over-the-counters, if not harder or more, because these are a little bit stronger. So you have to watch out for upset stomach. You have to watch out for high blood pressure, kidney disruption, thinning your blood. All these things still need to be accommodated for. Often your doctor will check those out. There is one called Celebrex or Celecoxib. Yes, this is an NSAID. However, this one is sometimes affiliated with lower risk of those side effects we discussed. So sometimes if an anti-inflammatory would be very helpful, then we might consider trying Celecoxib and monitor. Monitor your kidney, monitor your gut, monitor your blood pressure, and see if those things have been skewed at all. If not, then maybe we can proceed with caution. The next thing people often get prescribed and often kind of shy away from, at least at first, or a little bit scared and nervous about, are opioids. What are opioids? Opioids include morphine, oxycodone, hydromorphone, things like that. They're strong pain medications and they're prescribed more for severe or chronic pain. I'm sure you've heard that, they have, addictive properties. So when it comes to addictive properties, what do you need to consider? It's usually the number one thing I'm asked. Well, especially for an acute injury, often you're prescribed 12, 15, 20 pills. I'm not as worried about you becoming addicted because it's a small amount of medication that you're getting for a specific function like a surgery or a rehab from something that happened. But we do have to worry about it when it's gonna be more long-term. Addiction versus dependence. So if you're 75 and you have chronic pain issues and the doctor has prescribed one of these opioids for you, you might depend on it, but are you addicted? I don't know, it can be kind of confusing for some. And for the most part, what I usually say is addiction means you have different behaviors, not just different pain. So addiction means you're seeking the medication out. You're taking more than prescribed. You're getting it sooner than it should be due. Those behaviors means you're kind of not in control. But if the doctor tells you you can have an opioid and you can take this one pill in the morning and one pill in the evening, and you've been following that for 6 years, well, I'm not worried about addiction with you. Is it okay to need pain medication? Yes. Is it okay to depend on it? Yes. But when it starts to affect your quality of life when you don't have it, when you start to seek it out and abuse it, that's when we get more worried about addiction, okay? So some people have to worry about addiction more than others, but for the most part, the most important thing to avoid addiction is follow the guidelines your doctor has given. And if you're not meeting your pain needs, don't deal with it on your own. Include the pharmacist, include the doctor in the management of that chronic pain. You're also gonna wanna get into the habit of rating your pain. Is this a 10 out of 10, a 7 out of 10, a 5 out of 10? And no, there is no 11 out of 10, okay? 11 out of 10 just means 10 out of 10 and you can't manage it, okay? A lot of people go to the hospital because they cannot manage their pain and they need relief. So usually we can see it coming. Try to have a good team surrounding you so that we can address it. Other common side effects from opioids that are generally known are drowsiness, okay, and constipation. The drowsiness piece, you do have to be careful because you don't want to fall and hurt yourself and make your pain or your injury worse. With that said, very common for people to say, I hate opioids because it causes constipation. And then they avoid the opioid and then they end up not managing their pain well because Tylenol is not quite cutting it. They end up with 11 out of 10 pain in the hospital, not managing, and it's more so because they're too scared to take the medication that was prescribed for them because they're apprehensive about constipation. If you have chronic pain and you need medication, then we can deal with the constipation as a side effect, as a separate conversation, but it's manageable, okay? The thing about opioids is basically here's your bowel and you've got some flaps that act for motility and they move the poo, they move the bowel through the colon. Well, the opioids stop this motility. So the motion stops with opioids because that medication stops that movement. So then the bowel is not going anywhere. The stool is not moving. So we introduce a stimulant, Senecot, Dulcolax, or we include a bulking agent to make the package easier to move through the conveyor belt by adding Restorelax or Metamucil. Fiber essentially bulkins the stool, draws water into the stool, and allows it to move through the colon, okay? So if you've got constipation, let us know, we can deal with it. If you're falling a lot from your opioid, let the doctor know. That could mean either A, the dose is too strong, or it could mean B, let's switch to something else. So, you know, we're moving away from oxycodone and morphine, and you'll often see, especially in chronic or senior situations, the use of hydromorphone. A little bit less constipation, a little bit less aggressive drowsiness, but each person is different, so we can hit that as it comes, okay? With that said, if you or anyone you know are on opioids, especially if you're taking them regularly, in Ontario, we have something called naloxone, Narcan. Naloxone is essentially the antidote for opioid overdose. So if you or a loved one is using opioids, it can be easy to accidentally, or other people are doing it intentionally, but overdose on opioids. And basically an overdose on opioids, long story short, can cause respiratory depression. It can send a signal to your lungs to stop breathing. So the number one issue with people having opioid overdose, especially if it's opioids from the pharmacy, is difficulty breathing, shortness of breath, you know, losing alertness. So you can go to the pharmacy and get this here. It's called naloxone or Narcan. It's free for all OHIP and Ontario residents, okay? So even if you're not on an opioid, but a loved one is, you can get one of these and keep it in your car, even as an emergency, part of your emergency kit. You might save a neighbor's life or a friend or a family's life. And basically, this handy solution here is just a nose spray. And if somebody is having an opioid overdose, usually 1, maybe 2 sprays into the nostril helps to overtake that opioid overdose and helps that person to recover. With that said, more training is available at the pharmacy when we dispense it. Also, if you're unsure, check with your doctor if you have any questions about someone you know that may have an opioid addiction or issues with opioids if you've noticed this, but having this around can be very helpful and, prevent a death or a visit to the emergency room. If you have used one of these on somebody because you suspect an opioid overdose, we still always recommend a call to 911 to make sure that you haven't missed something. With that said, sometimes people need a second dose because depending on the level of opioid overdose, this will only work so far. So if somebody has a lot of opioids really saturated their system, then there could be a second wave where they go down. And that's why we call 911, and that's why we sometimes need a second dose. So opioids are safe when used safely. So some of the main things you want to consider with opioids is, especially if it's chronic, is there are immediate release opioids and there are slow release opioids. So for instance, Percocet, oxycodone is immediate release. OxyContin, OxyNeo, if you're familiar with these words, slow release. And what that means is if I've got chronic pain, I have this pain all the time, what we try to do is get your pain covered with the slow release options. Slow release means instead of it going up and down and up and down, slow release means we hit something we call steady state, much easier. But then for people with chronic pain, you might have what we call breakthrough pain. So I'm steady, bam, at 3 o'clock I get hit. Bam, at 10 o'clock it's way worse. So some people with chronic pain, they have both immediate and slow release available to them because when they have breakthrough pain, then they take the immediate release. However, the better your slow release regimen is, the less immediate release you should need. So if you're always at 8 out of 10 pain, well then maybe we should optimize your pain management to keep you at a 4 out of 10 or a 5 out of 10. How often do you have breakthrough pain? Once a day, twice a week, or 10 times a day? If you've got breakthrough pain 10 times a day, it likely means your pain is just not being managed properly. Go talk to your doctor, go talk to your pharmacist. It shouldn't be that hard. With that said, what is your goal? Is your goal to be 0 out of 10 in pain? In my experience, if your goal is 0 out of 10 in pain, you're probably going to be more likely to be over-medicated or overdosing. Why? Because you're really making sure the medication is working. That can be risky. Whereas, if I've got chronic pain, I might want to hover at 2 out of 10, 3 out of 10. 2 out of 10, 3 out of 10, you can manage, you can have a decent quality of life, you can carry on your activities daily, and ideally, you're not falling over, you're not super constipated, you're not sedated and drowsy or slurring. So making sure that the medication is not too strong can come at a cost in terms of your pain management, okay? For the most part, that covers opioids. Then there's maybe 2 more categories we're gonna talk about. The next one is, do you just have blunt pain or is it nerve pain? Nerve pain is often accompanied with descriptions such as burning, tingling, it feels like it's on fire, it hurts to touch, okay? So when you've got nerve pain, Tylenol is not gonna help because Tylenol only helps with basic pain, not nerve pain. If you have nerve pain, you're gonna often get prescribed something called Lyrica, AKA pregabalin, or gabapentin. Those medications specifically target nerve pain. And for the most part, what you need to consider there is that if you're treating nerve pain, it usually doesn't work right away. It can take 2 to 4 weeks, plus you need to optimize the dose until you see some benefit. So don't quit too soon if you're prescribed that medication, because often it takes some time. These medications are accompanied with drowsiness, sometimes weight gain or fluid retention, blurry vision. If these things happen, let your doctor know. Sometimes we can manage it by altering the dose, or sometimes if you switch from pregabalin to gabapentin, one seems to have less side effects per person than the other, okay? With that said, always remember with all medication, it comes down to the lowest effective dose. Don't take the max dose, you'll get side effects. Take the lowest effective dose. So if you need the max, you need the max. But with that said, try to go slow and have it in mind that, if you try to get to 0, you might be over medicated, or have it in your mind that it could take time to reach your goals. And not one solution is necessarily going to solve your problems. You might need a little physio, I need to stretch, I need to eat well, I need some Tylenol, and then slowly the pieces of the puzzle start to come through properly and you've got your pain managed. The other type of important pain management solution that we haven't discussed yet are compounds. So compounded medication means we make it from scratch in the pharmacy, okay? Not all pharmacies can compound. We've recently built a lab, and essentially what that really does is it allows you to get either, for instance, if you're getting drowsy with pregabalin or gabapentin, well, what we could do is we could add it to a cream so that you can get some topical transdermal local action where it targets your pain, but it's not running through the whole system causing drowsiness. The other benefit of compounded topicals are that we can include multiple ingredients in one. So before we were talking about Voltaren, aka diclofenac. Well, I recently made a compound that had, instead of the over-the-counter 2% diclo, it had 10% diclofenac plus 2% baclofen, which is a muscle relaxant, plus 5% gabapentin, which is a nerve-related pain medication that we just discussed, all in one form. The last thing I will say that can be beneficial about compounds is we can put it into a delivery base or delivery mechanism that allows for improved penetration through the skin to hit the site of action. So if you're unsure, that is something you can certainly investigate with your doctor. It does still require a prescription, but truly the benefit of some of these topical compounded pain relievers include that we've markedly reduced the risk of side effects and drug interactions. So for the most part, I've kind of talked about all of this in terms of what are the general recommendations and considerations for pain for seniors or for all. Please, by all means, drop a comment if you have any questions or concerns, or use this just as a tool in your toolbox when managing your or a loved one's pain. By all means, I'm going to try to do a couple more presentations like this, maybe every couple weeks or months. So if there's a topic you would like for me to discuss, by all means, DM me, leave a note, and I would love it if you could like, share, and subscribe. But for sure, great idea for you to share this to any loved one who has pain and might benefit from some of these tips and tricks directly from Mr. Sparkle in terms of how to understand and how to deal with chronic pain in seniors.